My name is Hani Marcus. I'm a consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery, which is part of UCLH. I have a particular specialist interest in pituitary tumours and the tumours in the related skull-base region. So I went to medical school at the University of Cambridge, and I underwent integrated academic training at Imperial College and at UCL. And I also did some international fellowships at Zurich and Calgary. And all those experiences have really shaped the way I operate, but also the technology research that I do. Well, I think what drew me to neuroscience is really the brain, and it's an incredible, complex and fascinating organ. It defines who we are, how we see the world, how we think, how we act. And neurosurgery in particular affords you a really unique ability to understand and protect the brain, and allows me as a pituitary surgeon to help patients see and improve their quality of life. So my expertise lies in doing minimally invasive surgery and endoscopic surgery, particularly for pituitary tumours, and doing these operations through very narrow, tiny corridors, usually through the nose. And that represents almost all of my practice. And it's a range that includes so-called non-functioning pituitary adenomas, Cushing's disease, acromegaly, prolactinomas, craniopharyngiomas, Rathke's cleft cysts. They're all tumours in the same region and can be tackled through these same approaches. So my research is very much focused around helping me do pituitary operations the best they possibly can be done and pushing forward the frontier of what we can do. And the two ways I do this are by developing AI to help us make better decisions during the surgery, and robotics to help us execute these decisions in a more precise and more effective way. And actually, we're the first group in the world to do this sort of research, the first group to use AI in live neurosurgery, the first group to develop a robot for these minimally invasive approaches. Pituitary tumours and patients with pituitary tumours really uniquely lie at the junction between several specialties. It's both in the brain, it's part of the endocrine system, and it's very closely related to the visual system. So we work as surgeons very closely with endocrinologists, ophthalmologists, as well as radiologists, pathologists, oncologists, to provide patients with the best care possible and ensure that we're really looking at every aspect of their care.